Popliteal fossa आप देखिए ये posteriorly we have the hamstring muscles, ठीक है, hamstring muscles हमारे पास 4 muscles हैं, ठीक है, सेमी टेंडिनोसिस, सेमी मेम्ब्रेनोसिस, मीडियल की तरफ दोनों जाएंगे, मीडियल की तरफ, सुपरफिशियल जो है सेमी टेंडिनोसिस होगी, इट इज अ पार्ट ऑफ द गायरोप्स मसल, गायरोप्स तीनों कंपार्टमेंट की सुपरफिशियल मसल, एंटीरियर की सार्टोरियस, मीडियल की ग्रेसिलिस और पोस्टीरियर की सेमी टेंडिनोसिस, उसके डीप में आपको ये सेमी मेम्ब्रेनोसिस मिलेगी, ठीक है। अच्छा, ये दे आर डाइवर्जिंग ओवर द मीडियल, आपकी बाइसेप्स फीमोरिस डाइवर्जिंग ओवर द लेटरल, ये दोनों डाइवर्ज हुई तो क्या होगा कि आप देखें ऊपर से ये ऐसे डाइवर्ज हुई, इस तरह से ये डाइवर्ज हुई, ठीक है, ये दो मसल्स इधर आई मीडियल की तरफ, ये लेटरल की तरफ, ठीक है। तो सेमी टेंडिनोसिस एंड सेमी मेम्ब्रेनोसिस एंड आपकी बाइसेप्स फीमोरिस। तीसरी मसल भी होती है यहाँ पर, मगर वो ऊपर ख़त्म हो जाती है, इसलिए आपकी एडक्टर मैग्नस का हैमस्ट्रिंग पार्ट, ठीक है। ये डाइवर्ज हुई तो इन्होंने ट्राइंगल बना लिया। आपकी लेग की पोस्टीरियर कंपार्टमेंट, मसल्स ऑफ द पोस्टीरियर कंपार्टमेंट ऑफ द लेग, यू सी हियर, okay, gastrocnemius, it has 2 heads, lateral and medial, both, and it is crossing the knee joint, means it is arising above the knee joint, means from the femur, both condyles, lateral head from the lateral condyle, medial head from the medial condyle of the femur, and from the lateral condyle we have another short muscle, thin muscle, that is called as the plantaris muscle. So they are arising from here and they converge downwards. They form a triangle again lower down. This is upper triangle. Both triangles they join to form a diamond shaped area here. This is called as the popliteal fossa. Okay, it is called as the popliteal fossa. So popliteal fossa having the boundaries, superior and inferior boundary. Superior boundary, medially we have the 2 muscles, tendinosus and semimembranosus. Laterally we have the biceps femoris. Lower down we have the 2 heads of the gastrocnemius. Laterally lateral head, medially medial head. सिंपल, जितना सिंपल रहेंगे उतना इजी आपको समझ में आ जाएगा। ज़्यादा डिटेल, पता है हमारे लिए प्रॉब्लम क्यों होता है, हम ज़्यादा डिटेल में जाने की कोशिश करते हैं। पहले बेसिक चीज़ें तो समझिए ना, उसके बाद डिटेल फिर होती जाएगी, और आस्ता आस्ता पहले 2 चीज़ें समझेंगे, फिर 4 समझेंगे, फिर 6 समझेंगे, इस तरह से। सो सी हियर, ये ऐसे बन गया। नाउ व्हाट हैपेंस दैट जो भी स्पेस बनता है नेचर ने इसलिए बनाया कि वी फॉर द लॉजमेंट ऑफ lodging the structures here, neurovascular bundle. In front of the thigh, upper third में thigh in front है, femoral triangle, middle third में medial side पे adductor canal, lower third में जो है आपका posterior side पे popliteal fossa. Now in popliteal fossa we have the neurovascular bundle, the nerves, arteries coming from the above. Okay, I told you that we have an artery, we have the nerves here, nerve from the. So see this diamond shape having 4 boundaries, having 4 angles, superior angle, inferior angle, lateral angle, medial angle. Okay, from the superior angle we see a very important structure here, it appears. This is a sciatic nerve. Sciatic nerve gives 2 branches, it divides here at the superior angle of the popliteal fossa. One branch, it goes straightly downwards to the inferior angle. One branch follows the superolateral boundary, means biceps femoris, and goes to the lateral angle. So this is going to the lateral angle, to the lateral side means that it is going to the lateral compartment, means to the fibula means to the peron, means that peroneal, so it is called as the peroneal nerve. It is for both compartment, lateral and anterior, common for both, so it is called as common. Then it is divided, superficial for the lateral compartment, deep for the anterior compartment. So this is common peroneal nerve, which is going straight to the inferior angle. It is a tibial nerve for the posterior compartment. Okay, now you see on the superior-medial boundary, it is formed by the semitendinous, semimembranous. The third muscle is the adductor magnus, hamstring part. Adductor magnus ends at the, suppose this is the condyle and we have here the adductor tubercle, it ends over here. Here it has this adductor magnus having the hole from where the artery passes, which comes from the anterior and medial side. Now it passes from here, this hole comes to lie in this So it is, this artery is a femoral artery. But when it crosses this hole, now its name changes. It is now in popliteal fossa, so it is popliteal artery. Popliteal artery crosses this, come to lie here. Now see, it is on the medial side. Whenever you are asked about the relations of the artery with the nerve, which nerve? The nerve which is close to this. Close to this is the tibial nerve. Common peroneal is away from that. So you have to show, you need to know the relation of this popliteal artery with the tibial nerve. So it is coming from here. Obviously we have a vein here also. So you have to compare the relation of these three with each other. So see here, what happens there? It is coming from the medial side. So in this upper part, the artery is medial and the nerve is, tibial nerve is lateral, obviously. Going downwards, and it is going like this. Tibial nerve is crossing superficial to the artery. Artery is deep. So in middle part, tibial nerve is superficial, artery is deep. Then in lower part, the artery is on the lateral side and nerve become on the medial side. Okay? So this is the relation. Upper part, artery medial, nerve lateral. Middle part, artery superficial, nerve deep. Nerve superficial, artery deep. And lower part, artery lateral, nerve medial. But we have a vein here. We have to show the relation of the vein. See, whatever the relation of the nerve and the artery, always vein is lying in between these two. बात ही खत्म, आपको समझ में आ जाए. वेन को बीच में डाल दें बस. अगर आपकी आर्टरी मीडियल है अपर पार्ट में और नर्व लेटरल है, बीच में वेन डाल दें. सो मीडियली आर्टरी, लेटरल टू दिस वेन, लेटरल टू दिस नर्व. अगर मिडिल में आर्टरी, नर्व सुपरफिशियल, आर्टरी डीप, नर्व बीच में डाल, वेन बीच में डाल दें. सुपरफिशियल नर्व, then deep is vein, then deep is artery. Lower down, when you will go lower down, फिर vein बीच में डाल दें. Laterally nerve, then medially vein, then medially artery. So this is the relation. So we have seen, we have seen here. This is the relation. These are the contents, important contents here. We have a roof here also. Roof is skin superficial and deep fascia. Deep fascia over the popliteal fossa is called as the popliteal fascia. But we have a fascia of the popliteus muscle as well. Popliteus muscle is lying deeply in the floor of the popliteal fossa. Floor of the popliteal fossa is formed by what? Above, it is the popliteal surface of the femur. Below, it is the popliteal surface of the tibia. And in the middle, we have the popliteus muscle. Popliteus muscle is covered by a fascia. It is called as the fascia of the popliteus muscle. Lot of difference between fascia of popliteus muscle and popliteal fascia. Fascia of the popliteus muscle is the fascia covering the popliteus muscle. Popliteal fascia is the deep fascia of the popliteal fossa. Fascia of the popliteus muscle is a part of the floor of the popliteal fossa. Popliteal fascia is the part of the roof of the popliteal fossa. और जब रूफ की बात करें तो आप काइंडली ज़रूर भी स्मॉल सिफरस वेन का जिक्र ज़रूर करें, वो वहाँ पर लगाएं. और आपके जो है लेटरल और मीडियल कोटिनस नर्व ऑफ थाई हैं, उनके पोस्टीरियर ब्रांचेस, वो भी यहाँ पे रूफ में आ जाते हैं, नीचे तक आती हैं ना, वो भी रूफ में आ जाते हैं. सो दिस इज ऑल अबाउट द पोप्लिटेल फोसा.